Hi, I'm Dr. Roland Halil, a pharmacist in the Briere Academic Family Health Team. A common question I get from prescribers is often, do I pick drug A or do I pick drug B? And prescribing can be complicated without a process. If you don't have a process for prescribing, it's difficult to prioritize all the variables that go into it and to strip away the marketing from the science. The 4 steps of rational prescribing are efficacy, toxicity, cost, and convenience. Simply put, if somebody asks you to swallow a drug, the first question you want to know is, what good is it? What's the efficacy of that drug? If there is any, the next question is, what's the catch? Because there's always a catch. How much is this going to run me, and how much work is this going to be? The first point is efficacy. When you're asking about efficacy, you really want to know, what kind of endpoints are we talking about? Are they hard endpoints, like a reduction in mortality or a reduction in morbidity? Or are we talking about surrogate endpoints that may or may not be clinically relevant, or even just symptomatic relief? Once you've figured out the efficacy of the drug, it's also important to ask yourself, what's the quality of that evidence? Are we talking about randomized control trials or meta-analyses, or really just anecdotal evidence because my grandma told me to? After that, you want to ask yourself about toxicity. There are really only 2 kinds of toxicity, common and bothersome, and rare and severe. Common and bothersome ones are the kinds that people have all the time, like GI upset or headache. The rare and severe ones are the ones that might get you into medical legal trouble and you really need to know about and inform your patients of. I'll give you an example. If you have a diabetic, you know that patient would benefit from being on an ACE inhibitor. But if they're in the middle of an acute renal failure, there's no way you're going to prescribe that medication. In this way, you recognize that individual factors can have a big effect on outcomes. When we're talking about costs, we know that somebody has to pay the piper. Costs are either borne by the patient or by society. They come out of your taxes or your insurance premiums, one way or another. And after that, of course, comes convenience. How much work a drug is will have a big impact on whether or not patients remain compliant. A drug that's once-a-day therapy is a lot easier to take than something that's 4 times a day. Something that requires regular blood testing is oftentimes a lot more difficult to take than something that requires none. Remember, if a drug has no real efficacy, why would you bother with the toxicity, the cost, or the inconvenience of therapy? If you practice this process regularly, you will internalize it and it will become reflexive.